Hello everyone, I am Dr. Ajesh Raj Saksena and I am a cancer specialist. And today I am going to talk to you about an important aspect of breast health, which is self-breast examination. Now, self-breast examination means that you examine your breast in a systematic way every month to be aware of how your breast looks and feels like. Now, the first question is when should you be doing it? It is ideally done the week after your period has ended, which is when the hormone levels in your body have again come down, your breast has come down to its normal size, and it doesn't feel painful while examining your breast. Now, if your periods have already stopped, you can pick one date every month to do a self breast examination. Now, how should you do this? If we can break it down into three systematic ways of examining yourself. Number one is to look at yourself, which is what we call as a visual inspection. You need to undress yourself till the waist and stand in front of a mirror. First, with your hands by the side of your body, look at both the breasts. Look for any changes in the size, shape, or symmetry, which means that if one breast appears bigger than the other, which means that if there is any visible changes in your breast, which can be either a lump, look at if one of your nipple has been pulled up as compared to the other side, look if there is any redness, if there is any discharge from the nipple. So these are the important changes that you must look for when you are examining yourself. The second aspect is to place your hands on your hips and press firmly. Now when you do this, you need to look if the skin over your breast is getting pulled inside, what we call as the dimpling of the skin. Now dimpling is the similar kind of dimples that you see on your cheek where the skin is pulled inside. The third aspect is to raise your hands above your head. When you do this, your breast gets lifted up. You need to see it also exposes the inframammary area. See if there is any lump which is visible at that time, and also any subtle changes in the skin can also become more prominent when you do this maneuver. Now, once you have done the visual inspection part, the second aspect is to feel what we call as the palpation. Now, the palpation involves feeling the entire breast in a systematic way. So, you need to feel yourself right from your collarbone till your bra line, right from the midline to your armpits. And you need to feel this with the pulp of your middle three fingers. Make sure that you use the pulp of your middle three fingers and not the tips. And this feeling has to be done in a circular fashion where you start either in your armpit and come towards the center, or start in the center and move towards your armpit. Make sure that every inch of your breast is systematically examined, and at the end make sure that you don't forget to examine the nipple region. The breast needs to be felt with a mild, moderate, or a firm amount of pressure which needs to be applied. Many people make the mistake of pressing the breast between your fingers. Now what happens is that even your normal breast looks like a lump. And when you do that, even a normal breast looks like a lump. The next aspect is to press the nipple and look for any nipple discharge. Now, once you have do that, the third aspect is to feel yourself while taking a shower. That means apply soap on your hands, apply soap on your breast, and when you feel your breast with soapy hands, even small subtle changes, small lumps which are the size of a pea can be felt better when you are feeling with soapy hands. So make sure the right hand is palpating your left breast and your left hand is feeling the right breast. If you feel any lump, don't panic, because not every lump is a cancerous lump. Consult your doctor at your earliest. Now, breast self-examination is not a replacement for a clinical examination and neither a replacement for a mammogram. It's an important aspect of being aware of one's own breast. Make sure that you do a breast self-examination once a month, every month. Please do share this video and help spread the awareness.